Hello, Stacey. Hello, Becca. And welcome to anybody who might be viewing this video at any point. My name is Dr. Spencer Bradshaw. I'm a professor up at Utah State University. And I do some research in the neuropsychology of interpersonal relationships and recovery research lab, and have stumbled across some great colleagues in Becca and Stacey, who I'll let them tell you a little bit about who they are and what they do, but we've had some interesting discussions so far, combining our thoughts about mental health and the brain, and combining our perspectives from a research perspective and with clinical perspectives. And we kind of found it pretty fascinating, and thought we might begin doing videos such as these, and who knows, if people like them, maybe there will be more to come. But we're gonna talk a little bit today about the brain, and we'll get into that in a minute. But before we go there, Stacey, Becca, I'll let you guys introduce yourself.
Wonderful. So I'm Bekah Schuler, and I'm a clinical mental health counselor. And currently my role is to facilitate treatment at Cascade Academy. We're a residential treatment center for girls, adolescent girls, who suffer from significant anxiety, depression, OCD, and other anxiety-related disorders. Of course, anxiety doesn't occur in a vacuum. There's lots of other things that come along with development and adolescent development. And something that we're passionate about is being part of research, evidence-based practices, contributing to research, so that we can always best understand how anxiety plays out in daily life, daily living, and best treatment options for a holistic, healthy life. And so I'm really excited to be part of knowing these great individuals and learning from one another, and two people here who are also very passionate about sharing with families and parents information that I think is just interesting, useful, applicable, and helps us have a better view of how to move forward on this journey. So happy to be a part of this.
Thank you, Becca. So my name is Stacey Jones. I'm a marriage and family therapist as well. And I'm also the owner of what is called BrainSculpt. So BrainSculpt is a bilateral device. It helps activate the right and the left parts of the brain in sequential order. And it's something that we developed as a stress management wearable to just help the brain kind of calm down on the go. I think we can all kind of relate to the idea that we're really dealing with this pandemic of stress. You know, we've had COVID, we've had all these kind of life-changing experiences. And I don't know that I've talked to very many people who say their stress is less than it used to be, that they worry less than they used to, that their mind ruminates a little bit less than it used to. It's the other way, where I think almost globally, independent of age group, really, we're seeing people just having higher stress, higher anxiety. And so that's one of the things that BrainSculpt is really passionate about, is just helping to be able to have hands-on in real-time tools that helps calm the brain on the go, utilizing some research that's been, it's been out there for a long time. So I'll go out and really quickly explain the whole concept of BrainSculpt and what we do and where it kind of comes from. And then I'll kind of turn the time back over to Spencer to go into more of the physiology of things. But so I'm not sure if very many of you have heard of EMDR, eye movement desensitization and reprocessing. EMDR is a technique and an intervention that's used specifically for PTSD and other types of high anxiety scenarios. But what they found when they were developing PTSD, it's a really interesting story actually how it was developed. Francine Shapiro was walking through the park, and she was watching birds fly across the sky from one part of the sky to the other. And she had just gone through, I think, cancer actually, and had learned to become really familiar with her body, really aware. And she noticed that when she moved her eyes back and forth, she felt different. She was a PhD student at the time. And so she told her advisor about this, and they decided to make it into a research project. And so she tried it with everybody that she knew. She's like, I can't simulate the birds, so just follow my fingers. And she just did this eye movement thing. And they found, whoa, that actually helps. And it evolved, 20, 30 years down the road. It's one of the most evidence-based treatments out there. And And so what we did is we took the bilateral piece of EMDR and we took it into kind of the context of putting it into a wearable where people aren't necessarily processing memories. They're just helping their brains to be calm, because they found in the research that the bilateral, a tactile bilateral, is also really calming to the brain. And if you think about that, EMDR did not develop bilateral. It just used it for this other thing, this other being able to manage and process through high anxiety. If you think about it, we've all been in the presence of a lot of bilateral when we're developed in the womb. We're developed in the presence of our mothers walking back and forth, rocking us in the womb. And then when we're born, we know that children soothe easily with being rocked and having that bilateral. And it just is something that's kind of innate within us. And so we just kind of took this bilateral that's just part of kind of our biology, really, and put it into a stress manageable wearable that people can wear on the go. So that's kind of just a really quick background on kind of what BrainSculpt is, and our hope is to just create more tools to reduce stress. So anyway, that's me. I also do private practice, and I'm also the clinical director of what's called Theratech, which is a clinic that utilizes different stress management wearables and just makes them more available for people. It has a free library of tools that people can kind of try out and integrate into their treatment as it fits. So anyway, Spencer, I'll turn the time back to you.
Awesome. Thank you, Stacey. Every time you talk about the left and right and moving back and forth and the bilateral and you bring up the womb, I told you this before, but I've always, the image comes into my mind of those athletes who are getting introduced at the starting lineup of their big game. It's a championship game or something. And, you can tell they're nervous. This is the biggest moment of their career. The nerves have got to be high. And as they're getting their name said and getting ready for the game to start, I see them kind of rocking back and forth on their toes, kind of mentally preparing for what's about to come. And anyway, I can't help but wonder if that is, I mean, obviously we know that is a soothing effect, right? And that's what we want to talk about today, and do it from, what I'm going to do is I'm going to share my screen here in a minute, and we'll go through some slides, and we can talk about the brain and the circuitry of the brain and kind of a neurobiological perspective of how the brain works and how anxiety might be involved in that. Stacey, would love to hear your thoughts along the way about how something like BrainSculpt or bilateral stimulation can help calm it and soothe it. And Becca, you'll have clinical insights from your experiences. And so does that sound like a good idea if we just move forward in that way?
Sounds good.
Okay, so I'll go ahead and share my screen. And we'll play this slideshow from the start. So just to give some background on the brain, and Becca, I love how you said that anxiety doesn't occur in a vacuum, right? There's lots of facets and features that go into it. And I'm not pretending at all today to say that this is the only way to look at it, or the only way to treat it, or that something like bilateral is the end all be all of everything. I think there's so many things that we have to talk about, but I think what we talk about today might be useful, and hopefully it's useful for someone. But if you've never heard of the MacLean's triune brain, I think that's a good place to start. And there are some critics of MacLean's triune brain, but it's been pretty widely accepted since the 1970s that human beings, tri means three, and un means kind of united or in unity. So the triune brain is, three brains in one, united in one. And this was from Paul MacLean, who was a neurologist, and kind of was looking at the brain and decided that the human brain actually kind of has three brains all wrapped into one. One he called the reptilian complex, which is kind of highlighted down in green here. And you got your cerebellum and the brainstem coming up, and the medulla and pons and midbrain areas. And then you've got an area of the brain he called the paleomammalian complex, which is this orange shaded area, and it's our limbic system. And we'll talk more about it in just a second. And then you've got your third brain, your human brain, which he called the neomammalian brain. And it's our cortex. It's what sits on top of the other two brains, and it's where we have consciousness. It's where we make choices. It's much more evolved and advanced, at least evolutionary speaking, than some of these other brains. But they all work together. but they have different and distinct roles. The reptilian brain is a brain that is responsible for sensory recognition. So everything that goes around us in our world, whether it be good or bad, or delightful or stressful, we take it in and it passes up right there at the brain stem, and our reptilian brain gets it first. If I were to relate this to a company, it's like the blue collar workers who are down on the ground floor, working hard so that this whole operation, this whole system can work. And then you have that mammalian brain, or paleomammalian brain. It's responsible for something we call valuation. And I might liken this in that metaphor of the company to middle management, people who oversee the blue collar workers. So it's in direct communication with the reptilian brain, and back and forth receives information. But what it primarily does is what we call valuation. It assigns value to things that are good or bad for our survival. The amygdala is considered a part of the limbic system, and that's our fear center of the brain that warns us when something could be bad for us or threaten our survival, or that everything's okay and maybe we'll be just fine. And then the human brain, or neomammalian brain, is much higher level of valuation. We call it evaluation. That's the conscious thought and decision making and information processing that I was talking about. And in terms of behavior, it allows us as human beings to be even more relationship oriented and care for ourselves and for other people even more than any other animal species. It allows us to evaluate situations, not only value things, but evaluate them and love deeply our offspring, for example. Speaking of offspring, if we go, let's talk a little bit about why Paul MacLean named these reptilian, paleomammalian, and neomammalian. Any guesses from Stacey or Becca, just so I can not hear myself talk for a minute?
He really liked animals.
He probably did. As a neurologist, he might have done a lot of studies with them too. What he noticed is the same structures in the brain. Some of my students will sometimes go, look, that cerebellum there coming off the back looks like a lizard fin, and so this whole thing looks like a lizard. That's why he named it. And that's interesting, but that's not why he named it that. It's because the structures in that part of the brain are the only structures and the same structures that are in the brain of a lizard, if that makes sense. So a lizard has a medulla and a pons and a midbrain area and a cerebellum. But a lizard doesn't have the amygdala and other components of the limbic system that mammals have. So mammals are more evolved and they have another layer of brain. And so that's why he called it the mammalian brain. And then humans have that cortex on top of the mammalian brain. So he called it the neomammalian brain, or human brain. Now it's not perfectly distinguishable, and that's where some of the critics of this theory come in, is, dolphins have a pretty big prefrontal cortex, and so do elephants. And so it's not like a cut and dry classification system, but it kind of runs a spectrum on living things. So, but the reason I bring that up is if we talk about offspring for a minute, and if remember, the reptilian brain is about survival. It's what keeps us alive. It's managing the next 10 to 12 seconds, making sure that we're safe and that we're going to be okay. It's where our cues about hunger come from. So every time he's hungry, whether it's 4 in the morning or 3 in the morning, and that's the part of his brain working unconsciously, trying to keep him alive. Do you know what a lizard will do if they've just given birth to their baby and their offspring sitting there, and their brain, which is the reptilian brain, and that's all they have, tells them that they're hungry?
They'll eat it.
They will eat their offspring, right? That's why sometimes we think of reptiles as a little bit heartless, right? Because they'll eat their own child. However, have you ever heard not to stand between a mama and her baby moose? Or have you ever heard the reference that, oh yeah, she's just a mama bear? What do people mean when they say that?
You have this protection over your offspring.
Yeah. And from a brain biology perspective, that's because mammals have additional layers of brain that allow them to assign value to things. They want to protect their offspring from threat instead of eat them when they're feeling threat, because they can assign value, and then humans are even more that way, right? Supposedly, sometimes we hear horrific stories in the news about inhumane behaviors, but ideally humans should be able to, love and care for their offspring even more than mammals. So anyway, I digress a little bit. I'm gonna move this forward and show you how this works a little bit. Okay, so these three brains are all really one brain, but they communicate with each other to tell us about our lived experience, to help us make choices, and then therefore influences our behavior. So here's a picture of a grizzly bear. Stacey and Becca, neither of you are running out of the room screaming. How come?
It's small.
You're not afraid of that, right? You can just turn off your computer screen, it'll go away, right? Mm-hmm. And it's small. I mean, essentially it's not real, mm-hmm. right? It's a picture. You and I know this. So were either of you afraid when I put that grizzly bear up on the screen?
No.
Okay. Well, let me show you what happened in your brain, because you're not lying to me, but you're both not being fully truthful. Let's put it that way. Because when you first saw this picture, your reptilian brain took in that sensory information, and it's a very low definition TV. It didn't realize at the moment that it was just a picture. It recognized bear. And through years and years and years of evolution, our brain, our reptilian brain, knows that bear is threatening to our survival. So for a very short minute, your midbrain, your reptilian brain, started to scream. It sent a message up to your mammalian brain, and specifically to your amygdala, your fear center, and there was a little bit of an alarm that went off, and you started to go, oh my gosh, this could be really, really, really bad. Now, of course, all of this is happening unconsciously. You're not aware of this until the mammalian brain sends it up to the neo-mammalian brain and checks with the CEO. So it goes from blue-collar worker to middle management all the way up to the CEO. The mammalian brain says to the CEO, hey, I'm about to, well, do you know what would happen if a real bear walked in your office right now, Becca, or in your room, Stacey, and it was clear that it was a real bear, not just a picture on a PowerPoint?
I'm finding my quickest exit.
Yeah.
Yeah, have you ever heard of fight or flight mode? We connect that with anxiety, right?
Yep.
In fight or flight mode.
Yep.
Fight or flight mode, our body it's a reptilian brain driven instinct that when there is a real threat, our body turns over our behavior to that reptilian instinctive brain to keep us alive for the next 10 seconds. The language processing and conscious thinking and decision making that our CEO human brain is really good at, we don't need that in a situation where there's real danger. Nobody's going to sit there and try and talk to the bear and see like, oh, I wonder if he understands English. Maybe I can tell him to go away. You just have to get into fight or flight mode, and you either fight the bear or you run away from it. Or we know now there's a freeze mechanism too when mm-hmm. either of those are going to work. Mm-hmm. But we only want to do that when we're really in threat. And so the mammalian brain, before handing the reins back over the reptilian brain and saying, okay, get us out of this through fight or flight, it does check with the CEO. And what does the CEO, who can further evaluate in a more detailed way, say?
It's fine. Yeah.
Says, hey, this is a picture
yep.
on a PowerPoint, a lot more conscious processing, tells the mammalian brain and the amygdala that it's all going to be fine. And then the amygdala sends back down to the fight or flight centers, the reptilian brain, and says, hey, just calm down. Now, all of this, neuroscientifically speaking, happens in 33 milliseconds or less, which is lightning fast. I can't even snap my fingers that fast. And pretty much the whole process is subconscious, except for that little bit that you got that said, oh, there's a picture of a bear, right? So you're not even aware it's happening. So this is a very beautiful system and way that our brain processes information and tries to help us avoid threat and go towards things that are good in life. But it's also a very delicate system. I've never personally known anyone mauled by a bear, but I've read stories in the news. Have either of you ever met someone in that tragic circumstance?
No.
It's happened to some people, and we would call that a trauma, right?
Mhm.
In a traumatic situation like that, how do you think this whole process gets altered?
That alarm's going to sound, that fight or flight's going to sound quicker, faster. It's going to perceive there to be more threats than maybe there truly are.
Yeah. And what happens in trauma, when trauma is basically an experience, a threat or a stress that is so intense, the brain can't handle it. It can't process it,
Mhm.
and it gets overwhelmed by it. And when that happens, it starts to, the brain goes through structural and functional changes,
Mhm.
and it's not working the way that it was designed to work initially anymore. It makes sense. They dropped the disorder from PTSD because it used to be called post-traumatic stress disorder. Now they just call it post-traumatic stress because they're saying it's not really a disorder. It makes sense if we understand the trauma.
Mhm.
But the brain pathways and communication between these three brains get messed up, and bottom-up control. So when the reptilian brain gets handed the reins and says, you're in control, this is a real threat, we call that bottom-up control. When the CEO gets to be involved and says, no, this is just a picture, calm down, no running out of the room, no freaking out, we call that top-down control. And in a situation where there's been trauma, someone's kind of in, the brain is like naturally moved to a way where they're processing related information from a bottom-up control type of way most of the time. And so if I showed someone mauled by a grizzly bear, a picture of a grizzly bear, and even if we were just in a classroom or on Zoom like this, they might start hyperventilating. They might start panicking or getting really anxious and agitated, and everyone else around them might be going like, what's going on with that guy? Or what's going on with her? This is kind of bizarre. Everyone else whose brain is intact going, hey, this is a picture, this is kind of interesting discussion. That person's stuck in an emotional place of fear. Does that make sense?
Mhm.
And so PTSD, anxiety, a lot of that involves what we call bottom-up control instead of top-down control. In most circumstances of life, we want to be in top-down control, where our conscious human brain that we have is working and kind of running the show and calling the shots and recruiting other parts of the brain to assist it. But in mental health disorders, particularly with anxiety, depression, a little bit of this too, and I do a lot of research with addictions, but this bottom-up control process takes over the top-down control. And the system that says fight or flight turns on, and the system that says stop or consider this or hey, this is not that big of a deal, it's turned off and pushed off.
Spencer, I wonder too, and I just can't help to think, in working with an adolescent population and, being a parent and having children, we know that the prefrontal cortex is not fully developed until definitely the 20s, right?
Yeah.
And, it kind of explains how you have toddlers who are behaving from just like this very primitive feeling and acting type behavior. How would you conceptualize the stop and the go for teenagers? And then what does a mental health diagnosis do in conjunction with that for development?
Yeah, so good question. And Stacey may have something to speak to this too, but I mentioned my 3-year-old, right? His neo-mammalian brain, his human brain doesn't even really start to develop until age 8. And you're right, it doesn't complete developing. An interesting little fact here, for a lot of women, this explains a lot of things, but women's brains go through puberty years before males' brains go through puberty. And so a woman brain might reach complete puberty and have a more developed prefrontal cortex by age 18 to 26 or something like that, whereas a male is going to be lagging behind maybe age 24 to 32, somewhere there, which is, gives us an excuse why we do some of the dumb things we do. But yeah, so during that process, adolescents, children, and even infants are highly emotional, right? Because those are the parts of their brains that are most developed. And so if they've gotten into a situation in life that's extremely stressful or makes them anxious, or if they've been through unfortunate traumas or other things, that the process is even more difficult for them.
Mhm.
I was talked about having done addiction research. We know that 1 in 10 adults, if they try a substance, is probably going to get addicted to it. When we talk about adolescents, it's 1 in 4.
Wow.
And a lot of that is due to the development of the brain and these relationships between the top-down control human brain and the bottom-up control emotional brain. There's other processes involved in that we won't get into with genetics and the unraveling of DNA and epigenetics and all that. But you're absolutely right. It's a big deal how old you are in the development of your brains. That our brain is so shapeable and moldable during childhood, and then most especially during adolescence. Some people say keep them alive till 25 and you'll be okay, but
That's a lot easier said than done. I don't think there's ever been anything quite so humbling as being a parent myself, and just, it is hard work. And one thing that I've kind of been thinking about, Spencer, as you guys have been talking about this, is the unique role that attachment plays in all of this, and the way that attachment influences, the activity or the hyperactivity, or the ability of that amygdala and kind of that more of that reptilian types of responses to be more moderate in nature. One thing that I really respect about the brain is how it can change, how it can grow. I love that. It just, for me, it really gives a sense of hope that, if we didn't have an idyllic childhood, or if we, had all sorts of curveballs fly our way, that we have the ability to kind of to modify all of the structure. So there's the structure of the brain, and we used to think it was like this machine, right? Like this cog only does this one thing, and this part never only does this one thing. We found that's not true at all. We've got the structure, but the way that they relate to one another and the functions that they play within that relation, and how one fires and creates the firing of the other, we have so much say in all of that, depending on the environment that we create for ourselves, both internally and externally. And so one thing that I don't know, I just really appreciate that, because I just don't know that there's very many of us that have come from a background where, everything was nice and rosy and the grass was always green, and it's just, life is crazy, especially now. And so I think sometimes it can be a little bit stressful for parents when we talk a little bit about brain development, because it seems so static. I mean, it seems so concrete, in the sense of like, it's like this concrete that once you pour it, that's all you got, and I just kind of wanted to plug that in, is that there's the organization of the brain, and then there's the way that it interacts with one another.
Mhm.
And those interactions are absolutely fluid, and we get to shape that depending on our bodies, the way that we treat our bodies, and the way that we build our relationships, and the way that we grow our environments.
Mhm.
And one of the sayings that I really love is the saying that we all grow old, but we don't all grow up. And that's by Gordon Neufeld. He's a developmental psychologist, and he talks about the unique role that attachment plays in this whole maturation process, and how, really at any given time, one of the best things we can do for our brain is develop good attachment patterns. And again, it's something there's kind of these pivotal moments, but it's something that you can learn at any given time. So I don't know, I just kind of wanted to plug that in. That's what kind of came for me as we're talking about all this. And, Becca, your sense of, like, your question about, well, how does this really play into adolescence? One other thing I really wanted to throw out there is, when I worked in wilderness therapy, one of the consistent conflicts that I saw a lot of parents get into, and also with residential treatment that I did, was parents would come at issues from the prefrontal cortex, and
Mhm.
adolescents are coming up from the amygdala. So we make decisions based off of different centers of our brain, and it's really it's a brain development thing. It's not a relationship thing. Like the difficulties and the struggle and the miscommunication, it's not because there's a lack of care or a lack of concern for one another. In a lot of scenarios and instances, it's because we're just using different parts of our brain.
Yeah, I love that, Stacey. I think about that just in the context of sitting together in a family session, and a student or a client has been able to verbalize what's happening for them, right? And sometimes the adult perspective goes, well, that doesn't make sense, right? And that's because we have that ability to use this other part of our brain that is more developed. And we hope that by sharing that knowledge that will somehow change their experience, but it doesn't, right? It's how do we see where their brain is functioning at that point and then help them through that process. And there's lots of different ways to do it and people to support through that process because it's tricky.
Well, and one thing I love that you said right there is the experience. Like if you want to change an adolescent's brain, you got to change their experience. It's the sensory stuff. Like that's what really sinks in. And with an adult, we're always going for the logic. I'm just going to help this make sense. Let's write our list. Let's figure this out. Let's problem solve it together. And for an adolescent brain, it's not even there's not like a little place for that to even really go. Like I remember working in the wilderness, and I would be the one that would walk the parents out to meet their kids for the first time in 8 weeks, and they would be terrified. And we'd kind of like get in a little circle. We'd talk a little bit about it and about their fears. And I would talk to them a little bit about, I love the land. We could always use the land as examples. And we talk a little bit about the rock that was like right in front of them. And then the horizon. And I said, no matter what happens, the one thing that you do always have the capacity to lead is the alignment between you and your child. So the tricky thing is that your adolescent is really focused on this rock right now. And you're thinking about, okay, let's compare this rock to the horizon. And you're just thinking, if I can just get them to focus on the horizon, we can make movement. But the reality is if you can just come and focus on that rock for a moment and sit next to them by that rock and align around that and build an attachment, a sense of connection, and then you can direct their vision to the horizon. But if we miss that step, sometimes we get stressed out that they're so focused on the rock. But really, if we can recognize that and learn to align with it, it's a really good thing that our prefrontal cortex is more developed, because otherwise we could never guide the development of theirs.
Yeah.
And so anyway, those are just some things that have kind of come.
Those are great insights. And it leads me to actually the next slide, which is a metaphor I use for what you guys are talking about, I think. How do we turn all this neuroscience stuff about the brain into clinically useful information? I first heard this metaphor from Dr. Glenn Vienstra at the University of Kansas, but he works with and researches anxiety disorders and the brain. He says, the subconscious parts of our brain, strongly the reptilian brain and a lot of the mammalian brain, are unconscious, and they're like a horse. And then the human brain, our CEO, our prefrontal cortex, and then maybe a little bit of the mammalian brain are like the rider on top of that horse. And he uses this metaphor because emotions and fear and anxieties are powerful, powerful things, right? Just like horses are powerful, powerful animals. I don't know if either of you have ever ridden horses, but if a horse wants to go one way to, get a drink of water, or he just thinks that's a good path, but the rider wants to go another way, who usually ends up winning that struggle? It's usually the horse, right? It's a little more powerful, and so they have to work together. And when they don't work together, there's a lot of conflict and a lot of struggle and a lot of pain. And the same thing goes on inside of us in our brains. When our CEO human brain is disconnected from our emotional survival-based brains down beneath, there's a lot of struggle and conflict. And usually the emotional brain is going to win out, even if it's not rational, right? It's not rational for a lizard to eat its child, but that's what it does in the moment, because that's what it thinks it needs to do to survive. And that survival, flight or fight, is a really powerful thing. I remember in high school, one of my friends, I was walking out, I think to use the restroom or something. I don't know if you had to have hall passes back then, but I'm walking out and there's my best friend standing in the hallway frozen. And I said, his name was Jordan. I said, "What are you doing out here?" And he said, "I'm supposed to be giving a speech in there. I'm supposed to be giving my presentation next." And I'm like, "Well, then what are you doing out here?" And he said, "I can't." He said, "I can't do it. I can't go in there." He had social anxiety about public speaking and presenting. And it would have been easy for me, and I probably did. I was like, "What are you doing? You're being stupid. You're going to get a bad grade. You're going to fail your class. This is going to lead to more grounding. We're not going to be able to hang out. Just get in there and give that darn presentation." right? But he was paralyzed in a state of fight, flight, or freeze. And his horse underneath his deciding brain was saying, we are not going in there.
Mhm.
It's a life or death thing for me. You don't get it, right? And people who go through these situations and who have anxiety and their brain has been wired in this way for whatever reason, they're trying, the metaphor here is to say, how do we treat our horse, right?
Mhm.
Do we develop a relationship with it, try to understand it, understand why it wants to go that way instead of this way, why it wants to look at the rock instead of the horizon? Or do we kick it with spurs and say, get in shape, follow me, I'm going to break you in, and I think that has some relevancy for our mental health, how we relate to ourselves and how we feel and what we do with it, but also how we relate to others who are going through situations that we may not logically understand, because to us it doesn't seem logical.
Mhm.
And I think that right there, if I can plug something in really quick, that's exactly the role that shame plays. I think in all of this, is because, I mean, shame, that's one thing that I've kind of researched quite a bit, is shame. And shame is like those spurs, those spurs of just, why can't I get this figured out? I mean, I think of all the people that tend to be the most critical of anxiety are those that have it,
Mhm.
and just how frustrating it can feel
Mhm.
to be in a scenario and to look around and to know that you're the only one, or that you think you're the only one that is responding in this way, and to recognize that that's a limitation, and to not be able to just get that horse to move. And so I think learning, I think as parents, if we, I know every scenario is so different and every situation is so unique in what is needed, but I've just found as a whole that anything that gets aligned around tends to make more movement internally and then externally. So like, for instance, I've got young children, and I can talk all day long about whatever they should be doing, but until I get down, eye contact, and I calm down so they can calm down, I can't align. And if I can't
Mhm.
align, I can't move them anywhere. And I think it's kind of the same place, internally. And I think, with shame just makes that so hard to do, because when you're so frustrated that anxiety is there anyway, it makes it so hard to get to that place where you can accept it and then you can move it.
Mhm.
Yeah.
It's like those spurs in that
Yeah.
horse.
I love this analogy too. And I'm just thinking about the students and the families that I work with. They're at this point, I mean, they're bright, talented, i- intellectual people. And there's this really tough piece of recognizing, why is this horse not doing what I want it to do? And they're developing their skills as a writer, right? They know that they should have this like writer proficiency, but they don't yet. And that's where I see the shame too, right? Where they understand how they should be going, or they think they should be going. They understand what they want the horse to do and how they want to control this other part of their brain, but don't have the skills or proficiency to do that yet. And then that, I think, enters in this shame, which leads into hiding and not really being truthful sometimes about what thoughts they're experiencing, what physical sensations they're experiencing, what's going on, because they just want to go. One of my favorite analogies with some of anxiety is, especially perfectionism, you just want to go, nothing to see here, right? And behind them is this gigantic horse that they're trying to like keep in control,
Uh-huh.
rather
It's
than
kind
come.
of going, kind of not acting, it's kind of going in circles like a storm's coming, right?
Yes, yeah, exactly. And so when we can come, and that's what parents can do, providers, mentors can come and help take the reins and say, let me show you how to ride this horse in a different way.
Yeah.
You don't need to do this by yourself, and that's okay. You've got a big animal here, right?
Yeah.
And I love Brene Brown, and all that she talks about with shame, and how one of the most effective things we can do in managing our shame is owning our story. She pretty much says, you either own your story, or you stand out the hall hustling for your worthiness.
Mhm.
Because, I mean, it's not like there's this little button. It's not like you just can't tell yourself to not be anxious. That just doesn't exist. And so when you can get to that place where you can really accept it and recognize that it's just part of the human condition. I think it's just hard because when you have anxiety, it's so easy to, those comparisons are so always, we compare others' strengths to our challenges, you know, and the reality is that none of us have our crap figured out. You know, like we're all just barely trying to make it by, you know, and anyone who acts like they aren't dealing with that is not really being real about the human condition, and how the human condition is a struggle. It is just a struggle. We all have our own struggles, and when we can just own the story of our struggles and accept them in compassionate ways, we can ride that horse completely different, because the horse learns to trust us, and we can move forward, and then it can allow others to be trusting as well, or it can trust others as well. And so anyway,
that's so awesome, Stacey. I love that. And before I move on to one other thing that I want to make sure we get to, because I think it'll allow us to talk more about this bilateral and both sides of the brain thing. I just want to mention that shame, those spurs, I think they find their way moving into people who care about the person with anxiety, people who care about the person whose rider and horse aren't getting along. And they start to feel shame too. So many parents sometimes will go, you know, that obviously isn't working over there, what they're doing, right? And I can't explain it, or it seems illogical. What did I do wrong as a parent? Why am I such a bad parent? Or why am I such a bad friend? Or why am I, you know, and they start to feel shame themselves, and then they might try and use a proverbial spur to get the situation to change, right? And it doesn't, and they feel worse about themselves. And so I just think this metaphor could be useful in so many ways. Let's talk about the rider for a minute with anxiety and the conscious human brain. So our prefrontal cortex, ignore these numbers here. This is an image that comes from a certain imaging device we have called FNIRS. But what's most important is that in the human brain, you know, as I mentioned before, we're supposed to learn what's good for us and what will help us grow and reach our full potential. And we want to assimilate that to our lives. And then we also want to understand what's threatening to us and will prevent us from doing that, and may threaten our existence, or you know, what we need to be afraid of. And the prefrontal cortex, as I mentioned, is the CEO, and it plays a role in that triune brain process. Ignoring the numbers, let's just focus on a few regions of the prefrontal cortex, and we'll split it by left and right. We got the right dorsolateral in red, we got the right dorsomedial in blue, we got the left dorsomedial in green, and the left dorsolateral in yellow. And these different areas have different functions. Stacey was talking earlier about how the brain is a network of relationships that works together, hopefully in a balanced way. And when things go well, these outer areas, the right and the left dorsolateral, the extreme outside areas of our cognitive control system, do just that. They help us make decisions. They help us in working memory and attention. They help us inhibit our behavior and say, no, let's not do that. They help us to calculate risk. And what's most interesting to me about it, and this kind of starts to bring in some of our bilateral discussion, is that the right side processes threat and avoidance. It's kind of got a negative glasses on it. It's the one that's going to communicate, hey, maybe you shouldn't do this because you might lose your job. Or maybe you shouldn't do this because someone could get hurt. The left side is more of a positive lens, and it processes approach information. Why should we do this? Maybe we should because it'll be fun. Maybe we should because it'll lead to a reward, and there's more reward than risk. So they're assessing reward versus risk. And they communicate with each other back and forth. You need both sides talking to each other. And then the medial areas are even higher levels of executive functioning that start to involve, you know, Stacey was talking about attachment. They allow us to be more social and to consider other people's feelings. And so not only do I go, hey, if I do this, I lose my job. With that right blue area, the dorsomedial area, I can go, not only do I lose my job, but what will that do to my kids? And how will that hurt them? And what will they go through? And so same thing, right side is inhibit or avoid, and left side is advance or approach, and they work together. And so let me just give you an example of how this could work metaphorically. I like metaphors if you can't tell. Let's say I had this gumball machine and I said, hey, Becca and Stacey, either one of you want to participate, I'll provide the quarter. You can see it costs 25 cents, but don't worry, you don't even have to pay that. I'll pay your entry quarter. All you got to do is you got to put the quarter in the machine, turn it, and if you get a yellow gumball, I will give you $1,000. That's it. That's the game. No other strings attached. Who wants to play? Okay, Becca was quick raising her hand. Stacey, you want to play? Yeah, most everyone would raise their hand, right? And what's going on in your conscious brain? You're processing that information, and the right side of your brain doesn't have much to say about why you shouldn't do this. There's not a lot of risk and not a lot of threat. And the left side of your brain is telling it, this is $1,000 and I don't even have to pay the quarter that might get me it. And so you raise your hand, you process that information, raise your hand. Now, what happens if I said, hey, Becca, Stacey, okay, I'm changing the rules a little bit. My wife doesn't want to go bankrupt, so we're going to do it this way. If you get a yellow gumball, you get $1,000. But if you get any other color, you got to give me $1,000.
No dice.
Taking the hand down. Now the left side of your brain took that information and said, avoid this. Don't do this. There's too much risk, not enough reward. Right? And so that's how the right and left side of the brain consciously process our world and make decisions about when to go for it and when to get away from it. And that's important when we talk about things like impulsivity and compulsivity. People who are pretty impulsive, their brains get rewired and they kind of see the world as a yellow gumball machine, if you will. And the rest of us are looking at reality. So both of these are examples of not healthy communication between the three brains. You know, the healthy brain will see this and process the world for what it is and deal with the reality in front of it. But impulsive people will have this biased perspective of only good can come from this. Why wouldn't I do it? And so if I change it and say, if you get yellow, then I give you $1,000. You get any other color, you give me $1,000. Most impulsive people keep their hand up and going, are you kidding me? Because they see reality differently. And then they get a blue gumball, and what do they say? It's time for double or nothing, right?
Yeah.
Double or nothing. How unlucky could I be? There must have been one blue gumball sitting at the bottom of that. That's impulsivity, and I've dealt with that and worked a lot with that in addictions, but maybe more relevant to our discussion tonight is compulsivity, where people see the world this way. And imagine this scenario. If I said, okay, let's go back to the center gumball machine. I said, okay, that was unfair. Odds were in my favor. Let's rewrite the rules again. Now, Stacey and Becca, let's do it this way. If you get a pink gumball, only pink, you give me $1,000. If you get any other gumball, I give you $1,000. Let's switch the odds here. Mm-hmm. Does your hand go up or down?
I'll play.
Well, most people will play, especially if you got $1,000 you can have access to. But a lot of factors to process, and that's what your brain is doing, deciding whether it's going to play or not play. Compulsive people see the world as just a scary place. People with bottom-up control whose horse is afraid of something, it's almost like, why would I do anything? Because anything I do could end up really bad for me. And they're hesitant to participate in life. They're hesitant to take risk at all because everything seems too risky. And we call that compulsivity. And we usually see that more with people who have anxiety, people who have eating disorders, especially anorexia nervosa and whatnot. Anyway, it reminds me of people at a bumper amusement park. I was watching my kids, and you've always got the impulsive kids and the compulsive kids who are in the bumper cars. The compulsive kids try to drive the whole 5 minutes without anybody hitting them. Yeah. They don't care, they don't care if they hit anybody. They don't care about anything else. They just don't want to get hit, right? Whereas the impulsive kids don't care if they get whiplash or something really bad happens to them. They just want to have a good time and go hit somebody really hard, right? I'm going to skip that slide and this slide, and we'll get to this for the sake of time. How does all that relate to anxiety? Well, maybe I will go back here just real quick on this. So how does the brain communicate? How do the human brain, the mammal brain, the reptilian brain communicate? It communicates through neurotransmitters. And I'm just going to focus on one for a second to kind of further illustrate this. I'm going to focus on dopamine, which is a pleasure neurotransmitter. But everyone's probably heard of serotonin by now, and endorphins and runner's highs and GABA and adrenaline. But let's focus on dopamine. The brain releases dopamine, which makes us feel good when we do things that are good for our survival. The reptilian brain sends off dopamine and says, hey, you need to drink. You know, when you have that drink of water that you're so thirsty and it tastes better than, and you're drinking from a rusty hose. Now I'm thinking of my old days at football practice. And it tastes better than any water you've ever had. And you go, oh, that was the best water I've ever had. And it's because you're so thirsty, your brain rewards you a lot for drinking water so that you'll do it again. Same with sleep. Some of you've had the best sleep you've ever had. Other pleasurable activities. And the brain has a reward system that rewards us with dopamine. It hits a certain threshold. And that's when corticotropin releasing factor, or cortisol, it's a stress system or anti-reward system, starts to push back and balance it out, because we're supposed to live a balanced life. And that's normally how it works. Again, I don't mean to bring so many addiction things into this, but when people do drugs that tap into big releases of dopamine in the survival areas of the brain, you get these huge spikes that overwhelm the brain, and that cascades a whole process that develops into what we call a drug addiction. But if we keep this with anxiety, there are ways people can get huge dopamine surges and as a reward by not doing things, by being compulsive and trying to stay away from harm's way.
Running away from the other bumper cars. Yeah.
Yeah. And so here's where I was talking about that anti-reward system and the relief you get when it turns off. If we imagine a bunny in a forest, and the bunny sees a carrot and thinks, I want to go eat. I'm hungry. I need to eat to live. The reptilian brain is saying, eat, eat, eat. And it's a mammal, so it's not going to eat its child. It's got to find something else. So it sees the carrot and it starts to move toward the carrot, but then it hears something in the bushes, right? And out of the corner of its eye, it goes, oh my gosh, there's a fox over there. And now there's a decision to make for this rabbit. Do I go and approach the carrot and get a reward and get pleasure and get full and live because I'm hungry? Or do I avoid and get the heck out of here because I might get eaten by the fox while I'm trying to get the carrot? And most people, most animals are going to get away. They're going to get away from the fox. Impulsive people might go, I don't care if the fox gets me, that carrot looks so good. But compulsive people, anxious people especially, are going to run from the fox, and then they get to safety, and they get a huge sense of relief and pleasure, not because they got a carrot, but because they didn't become a carrot to the fox. And that is a rewarding experience associated with what we call an anti-reward system. And people can actually kind of get a little bit, I don't know if addicted to that is the right word, but it is a habitual process that people stuck in anxiety loops are dealing with. And what that means is, if I hook someone up to a brain machine who has an anxiety disorder, I'd probably see a hyperactive right side of their brain. Because what they're seeing in the world is foxes everywhere or red gumballs everywhere. And it influences everything they do. And it's being driven by their horse who's dealing with fear instead of by maybe the reality everybody else wants them to see.
Yeah. And Spencer, I'd add on to that too, is a lot of times it's just the idea that there could be a fox, right? And so I think a lot of people would say, okay, well, it's good to make sure that you don't become the meal. But for some people, the anxiety has gotten so severe and significant that there's no fox there. It's just the possibility of it being there.
Or maybe it was there once, but not anymore.
Right. Or it's the picture of the fox, right? And the brain's not coming back saying, actually, that's just a picture of a fox. You're safe to go. Right.
It's wired in this bottom-up control way. And that's where I feel like this discussion, I think, can sometimes help a lot of people go, this is not my fault, right? whether it's family members saying I didn't parent them the wrong way, or persons dealing with this anxiety going, why can't I get my horse to do what I want it to do? It's not really their fault. There's a neurological process underlying all of this, that all of that other stuff, choices and behavior, heavily depends upon. And until we can work with that and heal it through therapy and other treatments, it's kind of hard to just willpower your way through it, I think.
And one thing really quick with that, and I'm hoping I had to take out my video because I was starting to get kind of some weird feedback, and I didn't want it to kind of mess up the audio here. But one thing that's really interesting about the visual cortex of the brain is that imagination is almost as good as the real thing. Like the same neurons fire within the visual cortex, whether you imagine something or you're actually experiencing it. So for people who are dealing with anxiety, that fox, whether or not it's real or imagined, is kind of the same thing. Like and I love Patch Adams. I don't know if you guys have seen that movie, but there's this part where and I'll just give a really, really quick story about it. But he's this doctor who at first is in a psychiatric unit as a patient because he's had kind of a mental breakdown, and his roommate is convinced that there are squirrels in the room and he will not use the bathroom because of the squirrels. And so he holds, he has to go to the bathroom. He holds it all night long, and he can't sleep. And everybody's trying to convince him that the squirrels are not real. The squirrels are not real, but to him they are. And so Patch finally gets to a place where he just aligns. He's like, okay, we're just going to barricade ourselves, and we're going to get these guns, and we're going to get those squirrels. And he finally gets the squirrels, and then he makes movement into the bathroom. And I don't know, I have just learned to have great compassion for people who experience things that may not be on the radar of other people's realities, because I just have learned that if we really want to align with somebody and move them through a distress, we really have to acknowledge what that distress is doing to them, whether or not it's perceived or real. Just because we don't see the fox doesn't mean they don't experience the fox. Because again, imagined and real experiences are kind of the same thing in the brain. Very similar things fire. And in fact, in terms of the neuroplasticity of the brain, it pretty much is the real deal. Anything that is truly imagined and believed is the real deal in terms of how it changes the brain.
Yeah. Stacey, with I probably have about 5-10 minutes left. I don't know about your guys' schedule, but for this last little bit, can we kind of return to this bilateral activation of the brain? If I go way back to the brain and I talk about left and right and fear-based or let's go do it based, these are the people who just want to go to who want a little taste of heaven. They don't care if they end up in hell. And these are the people who, they don't care if they end up in heaven. They just don't want to go to hell. Another way to explain it. And we talk about the right sides and left sides working together. You brought up Francine Shapiro and trauma and anxiety, and saying that when she was moving her eyes back and forth following the birds, it was activating right and left in sequential manner. Yeah. And that kind of gave birth to EMDR. Well, maybe you want to speak a little bit, Stacey, to kind of how that works. In a way, it makes sense to me that it's bringing the left and right hemispheres of the brain back online so they can process the anxiety or the fear that wasn't able to be processed before in the case of trauma. Or maybe with anxiety, it's still strengthening the rider, hopefully in a way that it can work with the horse a little better. But maybe you want to speak to that, or Becca, you could too, and even BrainSculpt's role in that.
Sure, I'll take a stab of it really quick. One thing that I've really come to respect in terms of how the brain is built is the role that the body plays in that process. Vessel van der Kolk is one of the leaders in trauma research, and he one of the things I think he's really helped us understand as a field is that it is the body that builds the brain. We kind of see that the brain is kind of like the thing that drives everything else, but no, in reality, it is your body that is building your brain. The sensory experiences they have, especially for adolescents, when that prefrontal cortex is not quite so developed, their body has a huge impact in terms of how the brain is being developed. And so one thing that I'm really passionate about is the idea that our bodies and our brains were designed to move in the presence of stress. There's a lot of research that verifies that those who were not allowed to move in the presence of a traumatic experience or even a high stress experience had the symptomology that developed afterwards was a lot more acute for them, a lot higher and a lot more intense. And so when you go back to that example of the bear, The primitive brain is not only designed to recognize a threat, but to move from it, to move away from it. And I think that movement, I mean, if you think about any type of movement, it always involves a left and the right part of the brain. I can't think of very many movements that move your body from point A to point B that uses your body to move it, that isn't using the right and left part of your brain, of your body. And so one thing that I really think is missing in a kind of like the puzzle piece as to why anxiety is developing and why is it getting so intense is I don't think we're having the types of discussions we really need to be having about what our body is doing in the presence of that stress. If you think about it, we all kind of live in these, we've kind of been built into these concrete cages. If you think about how historically we had to work the land to live. You had to build your house, you had to grow your food, you had to walk to work, you had to bike to work. To get from point A to point B, your body had to move. And we don't do that anymore. We drive to work and we sit on a computer and we sit at school and we sit on the way back home from school and at home and on our phones. There's nothing bilateral about the majority of what we do anymore. And that has an impact in terms of the imbalance, because now you've got a stressed brain that is sitting in a still body. And that's happening across the spectrum of ages, like younger and younger ages, kids are moving their bodies less and less. And so that's really one of the things I'm a little passionate about it, but I'm convinced that part of what is going on is that we are missing movement in our lives. Mm-hmm. We're missing bilateral in our lives. And again, so, I mean, in terms of its impact, we know that bilateral is soothing to the brain. EMDR didn't develop that. They just utilized it for the specific purpose. But we know that babies calm when they're rocked. But we don't really recognize how we need to integrate that into more of our lives. And so there's a lot of situations where you're not allowed to do bilateral. When you're at class, you have to sit. When you're sitting, it's really hard to type on a computer and be moving around your body at the same time. Like we are kind of constrained in our societies, yet we are stressed in our societies. And I think that stress and that constrainment is a lot of the reason why there's a lot more anxiety than there used to be. Mm-hmm. Higher stress and more constrainment they're gonna go together in terms of developing some of the stuff that we're seeing. And so and that's some of the stuff, we're starting to do some specific research, in the near future, looking more specifically about how BrainScope and the right and left activation of the body and how that helps activate the right and left parts of the brain. We're really excited to find out more specifically what that looks like. But even before BrainScope, going back from the beginning of time, really, man has always had to move. It's only recently that that's gone away. And so that's one of the things that we really hope to change is helping people to recognize that that's part of what they need to.
And Stacey,
I think there's something really to that, the transmit, no matter what your treatment approach is, right, whether it's going to be movement or something like BrainSculpt that does this very safe bilateral activation, or whether it's transcranial magnetic stimulation by doctors who will start to put probes in and electric shock different parts of the brain. Mm-hmm. If someone's really depressed or anxious, they're going to put a cathodal stimulator on the right side of the brain, try to get it to stop firing, and they're going to put a nodal stimulator on the left side of the brain, start to get it to work to try and balance the two sides out. Yeah. And so there definitely seems something to it, and I'm excited to research that a little bit too. This is not a pitch to invite people to participate in our research. I need to make that clear, but I am excited about it for sure.
Mm-hmm. And Stacey, as you were talking, it reminded me of a podcast I recently listened to. Dr. Emily Nagoski was talking about completing the stress response cycle, and that always has to be done with a physical movement. And it's tapping into the exact bilateral processes that you're talking about. For our brain to feel like the threat is gone, or we're safe, or things can process and be resolved, there has to be bilateral movement.
Yep. And how we don't really think about that. We think about how nice these kind of advances have been because they make things more efficient, or they get us from point A to point B more smoothly, but not so much for the brain. It really breaks up a lot of patterns that are meant to to play all the way out.
Mhm.
You know, and you'd see how that would create kind of unbalanced networks within the brain when there's a surge of something, and it only goes through half of the cycle that it's supposed to.
Mhm.
And then it happens over and over and over again. That a brain that moves, a body that moves a lot has a very different brain than a body that does not move, especially if it's, you know, dealing with stress at the same time.
Mhm.
I put this last list on a slide here, you know, thinking in addition to bilateral, what are other clinical implications of this? I don't, you know, these are not scientifically proved or researched or anything, but I was just trying to think like, you know, from this perspective, willpower alone usually isn't sufficient, right? You can't just tell your rider and your horse to start getting along and then you wake up and it happens. It's much more involved than that and more delicate than that. I like the idea that the brain is just an organ, like our liver, like our pancreas. It's a place. We are not our brains, and what we think doesn't necessarily mean that's what we are. Choice and behavior are delicate. Sometimes they need to be repaired. These things I've heard in the addiction world, and I don't know if they apply to anxiety. Becca, maybe you can speak to that, but the importance of trusting someone outside of yourself.
Mhm.
If your brain is seeing a pink world instead of the colored world that we want to all see,
Mhm.
you know, sometimes they'll say to people, your best thinking got you here to treatment, or your mind's a dangerous neighborhood, probably don't go there alone.
Yeah.
Sometimes you need other people to sort through it with you.
Well, and just to plug on that really quick, again, is we not only do we not move, but we sit alone. We sit alone on our computers. We sit alone. Like maybe we're interacting with people on our phones, but not in person.
Mhm.
You know, and so the neurochemicals that develop in in-person interactions also aren't there. So anyway, just another plug about how it makes sense that we're
Yeah.
seeing what we're seeing.
Yeah. And I think too, you know, in the case of anxiety, OCD, we're doing work with exposures, right? We're saying, please trust me together that this is safe. I know maybe your logical brain knows that, but the rest of your horse is running away. And so allow your horse to come with me.
Yeah.
And
I'm going to walk with you to the carrot. I know you think there's a fox there, but I've
Yep.
looked. I don't think there. Yeah.
Exactly.
Yeah. Awesome.
Well, that's thanks for having that discussion tonight. It went longer than I thought, but I enjoyed it very much.
You guys, we were saying earlier, we could talk for weeks about this stuff. So I think there's so much information and so many ways of thinking and applying it. And I think hopefully it's really applicable to people who are listening, because I think there's so many ways that this just shows up in real life for every single one of us and our families.
Yeah. Wonderful. Well,
Well,
yeah, I just really appreciate this time too to just kind of brainstorm. You know, I think kind of like that same thing. Great minds always create more than what one single mind would be able to create on its own. You know, so it's been great to have this chance to kind of bounce some ideas around.
wonderful.
Awesome. Thank you all.